impossible. I swear, that's how long he took it.
Come on, you've got to get through all that.
Then he got his saw and cut through the bone.
What about the bleeding? How do they stop the bleeding?
Good morning, sir.
Mr. Holdsworth? Mr. Horton?
He used ligatures to
Thank you.
In a few moments, I shall perform the amputation of a limb. Our case today is a young girl of 11 whose leg became entangled in the machinery of a mill. The wound is large and already inflamed, but the chances of her survival remain slim. Poisons from the inflamed wound may yet claim her, despite our efforts today. I shall acquaint you with the basic procedure in which I shall employ two principal tools. The first is this surgical knife with which I cut the flesh and muscle. I then release the knife. Speed is crucial. Hold back the tissue with my right hand and cut and sever the bone. The bleeding arteries must be secured immediately using these ligatures. But may I remind you that during an operation, the surgeon comes under immense pressure. The agonies of the patient penetrate through to your very soul, but you must focus on the task in hand.
Here we are. Gently, easy does it. Is the patient ready, Mr. Holdsworth? Stand aside.
I'll give her some laudanum, sir, to quieten her.
Keep the pressure firm on the first cut. Deep and clean. God help the child be strong.
Oh, please help me. I must be strong. I must be strong.
The harrowing story of Hannah Dyson. If this accident had happened after 1847, Hannah is likely to have felt little to no pain at all. And that's what this video is about. Now, that video on Hannah Dyson also uncovers some other problems to do with surgery in the 19th century. You can just about make out in the background that the men are talking about some of the other problems in surgery during this time. How the surgeon is going to overcome problems of blood loss, for example, and also the risk of the patient dying of infection. Later on in this video, we have a look at the question 2 of the Health and the People paper for the AQA Spec, the Explain the Significance question. But this video specifically focuses on overcoming the problem of pain during surgery. Attempting to relieve pain during surgery was not a new thing. It had been attempted by the Romans, the ancient Greeks, the Egyptians, and pain-deadening substances such as hashish, mandrake, opium were also used during the medieval period. However, throughout this time, it was always difficult to judge what was an effective dose and what was a lethal one. There was, of course, alcohol, but it made the heart beat faster, it made bleeding more difficult for surgeons to control, and also some patients were religious and objected to taking alcohol and preferred instead to sing hymns and suffer through the pain. In 1795, the Bristol physician Thomas Beddoes and his young assistant Humphrey Davy experimented with inhaling nitrous oxide, otherwise known as laughing gas. Davy published his account in 1800. He described how the gas made him laugh and feel giddy and relaxed, but he did not recognise its medical value. It became a fairground novelty. People paid to inhale it and then fell about laughing hysterically, much to the amusement of the crowd. But it wasn't until 1844 that American dentist Horace Wells saw this laughing gas as an anaesthetic and used it in the removal of his own teeth. Around about the same time as laughing gas was being used, another American dentist, William Clark, experimented with a different chemical, ether. In the January of 1842, he used it in a tooth extraction. In the March of that same year, an American country doctor, Crawford Long, used ether to remove a neck growth from a patient. In October of that year, William Morton helped to give a public demonstration in Boston. News of this American anaesthetic quickly spread to Europe, and Britain's most acclaimed surgeon Robert Liston was keen to try it. He called it the Yankee Dodge, and he used it in a leg amputation. So this anaesthetic proved to be effective. It did have its drawbacks. It was difficult to inhale, it caused vomiting, it was highly flammable. So therefore, for convenience and to avoid hospital infection, many patients chose to have their operation at home in front of an open fire. So using ether in these circumstances could be disastrous. So I just want to remind you of some of the surgeons before the 19th century that specifically tried to deal with the problem of pain. Let's start off with probably the first known English surgeon during the medieval times, John of Arderne. So John Arderne set up the Guild of Surgeons in 1368. He is known for his surgical manual Practica, published in 1376, which contained illustrations of his operations and instruments that he used. He was influenced by Greek and Arab medical knowledge. He gained his experience on the battlefields during the 100 Years' War. He used opium and henbane to dull pain. Now, there are many other medieval surgeons that we can look at in other videos, but for now we're specifically looking at those that dealt with the problem of pain. Now, you could also say that Ambrose Paré, the Renaissance surgeon, although he was famous for prosthetic limbs and tying ligatures around bleeding wounds, also managed to reduce pain whilst treating his patients on the battlefields. So Paré was a French army soldier who treated wounded soldiers on the battlefields. He's famous for his cold ointment made up of egg white, rose oil and turpentine. He created this ointment out of desperation when he ran out of hot oil. It was effective at treating the wound, but also patients felt less pain than when previously treated with hot oil. But the real breakthrough in anaesthesia came in 1847 when a Scottish doctor, James Simpson, discovered chloroform. Simpson and 2 other doctors had been testing a number of different substances when somebody knocked over a bottle of chloroform. When Simpson's wife later came in, she discovered all 3 of them sleeping peacefully. Simpson started to use chloroform on his patients, but it was met with great opposition. First of all, doctors did not know how much or how little of chloroform to give. Most famous case was Hannah Greener, who died in 1848 during an operation to remove her toenail. But there was also religious objections to removing the pain of childbirth, for example, as it was thought to be God's will and punishment for sin. Also, a few army soldiers during the Crimean War thought that the soldiers should dutifully put up with the pain. But chloroform was endorsed by Queen Victoria. Dr. John Snow convinced her and her husband that anaesthetics were safe, and on the 7th of April 1853, Snow used chloroform to help Queen Victoria give birth to her 8th child, Prince Leopold. The Queen described the effects of chloroform as soothing, quieting, and delightful beyond measure. So although this was a major step forward in the conquest of pain during surgery, surgeons still didn't know how to avoid infection, with many patients still dying of blood poisoning shortly after an operation. And there was still the problem of blood loss. So now let's have a look at that significance question. So explain the significance of anaesthetics in the development of medicine, and it's worth 8 marks. The development of anaesthetics in the 19th century was significant, notably when James Simpson discovered that chloroform could send patients to sleep during surgery. Simpson discovered this in 1847, and it enabled surgeons more time to carry out surgery without the patient having to be held down throughout the procedure. However, there was initial opposition to chloroform as it could lead to deaths because surgeons did not know how much to give the patient. For example, Hannah Greener died in 1848 during an operation to remove her toenail. This led to opposition against anaesthetics by people who thought they were more harm than good. Chloroform was supported by Queen Victoria, however, after she used it during the birth of her 8th child. Nevertheless, patients continued to die of blood poisoning after surgery because surgeons did not yet understand about infection. The development of anaesthetics also has long-term significance. In the 21st century, surgeons use a safe mixture of chemicals to produce gradual loss of pain and consciousness, which leads to better and quicker patient recovery and even more complex operations. For instance, the most advanced modern anaesthetics allow brain surgery with the patient being unconscious, like in the treatment of epilepsy. I hope you found this helpful when revising for your Health and the People medicine exam. I hope to make videos on how surgeons overcame the other problems when performing surgery, notably the loss of blood and also reducing infection and reducing those deaths from blood poisoning shortly after surgery. So please look out for those. And if you have found this video helpful, please give it a like, subscribe, leave a kind comment, and I hope to make another video for you soon.